How transmissible and severe is Omicron, and how worried should we be? Let's get answers from CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, thank you so much for joining us. The last time we spoke in August, we were all concerned about the Delta. What are health officials telling you about this Omicron variant?
Well, I think that they are cautious right now, Rico. We are seeing the scientific process sort of unfold real time, but we do know that at least within areas of South Africa, this has become the dominant strain, the dominant virus. So you remember when we last spoke, Delta was sort of emerging and then within weeks became the dominant strain in places like the United States and many places around the world. You've already seen that in South Africa with this, and there's reason to suspect, as you point out, that in other countries around the world, probably every country around the world, will have evidence of Omicron. So that's, I think, becoming clearer, the transmissibility, if you will. What is not clear is, does it make people more sick? How well do vaccines hold up? I will tell you one thing, Rico, I think is interesting. Just last night I was talking to some sources, and they talk about this idea that as viruses become more transmissible, they often become less lethal. So, you know, viruses want to spread, but they don't want to kill their hosts. So that may be the case here as well, but we just don't know. It's very early days still.
Early days and still many questions about the Omicron variant, Sanjay. And, you know, for a couple of months, the Philippines was hit hard by the Delta variant. And now that the economy is getting back on its feet with low infection and positivity rates, we now have the emergence of this new COVID variant. So, Sanjay, is it too soon to call for travel restrictions with still so many questions in the air?
Well, I think the issue with the travel restrictions, Rico, is that you have to really determine how effective you think they are. Everything is a risk-reward relationship, and you have to, again, assume, given the amount of global travel that happens, that this virus, this variant, Omicron, is probably in most places around the world already. So what do you really achieve by these restrictions? And the restrictions are usually very porous. So in the United States, for example, citizens can still come back into the United States, even from South Africa, but they're restricting other travelers. That doesn't make a lot of sense. The virus doesn't care if you're a citizen or not. So I think that we learned a lesson last year. Here in the United States, we put in travel restrictions from Europe, for example, in the middle of March last year. And then when we went back and looked at the data, we realized that at the beginning of March, the virus was already circulating pretty widely. So I think in some ways it's not too early to put on travel restrictions. It's too late because the virus has already spread.
At this point, Sanjay, the Philippines has already received close to 55 million doses of the U.S. vaccines from Pfizer, Moderna, and J&J. What are researchers telling you at this point? Will the American vaccines hold up against the Omicron variant? And will we really need a booster to save us from Omicron?
Let me try and explain it this way. First of all, I think the honest answer is we don't know yet. You're dealing with a virus that has several dozen mutations. Some of these mutations we've seen before, some of them are new, but the real question is, what does it look like when it's all put together? It's like cooking. You're putting all these ingredients together. You don't know what's going to come out necessarily on the other side. What most vaccine makers are telling me is that it's likely that this vaccines that we have, the ones you mentioned, are still going to be effective against Omicron, even if they diminish in effectiveness to some degree. They're still going to be effective in terms of preventing severe illness. That's the expectation. But I think it raises 2 points. First of all, for people who have not yet been vaccinated, you should get vaccinated. There is evidence that people who have previously had COVID and believe they are protected, they may not be as protected against Omicron because it is such a different virus. The second thing is, you know, if you're eligible for a booster right now and you can get a booster, you should probably do that as well. Why is that? Because when you get a booster, you're adding even more antibodies to your blood, and that gives you a bigger cushion effect. So again, there may be some erosion of the effectiveness, but if you're vaccinated and boosted, that's going to give you the best shot. In addition, I'll just say, Rico, to simple measures like masks. I mean, you know, regardless of what kind of virus or variant it is, a high filtration mask, especially when you're in indoor public areas, is really effective. People don't like to wear them, but they can be really effective, especially in the cooler and drier months.
Just like yourself, Sanjay, I'm also wearing one, you know, here in the studio. Of course, in anticipation of these vaccines and boosters not working against Omicron, are vaccine manufacturers also coming up with new vaccines and boosters to fight this specific variant?
Yes, they are. I mean, that's been one of the brighter spots in all of this, Rico, is that what they're doing already is that they're, based on the genetic code of this new variant, Omicron, they are creating new vaccines. And they think within 3 months or so, they could have not only the vaccine made, but some initial data on how well those vaccines might work against Omicron. So, it used to be years before you could count on a vaccine, and now you can shorten that time frame to months. And I should tell you that even against Delta and Beta, these vaccine makers did make specific vaccines for those variants. Mm-hmm. In the end, they didn't really need them because what they found was the existing vaccines worked really well. And that may be the case here also. But they're already working on new versions of the vaccines to specifically target Omicron.
Thank you so much for joining us on The Final Word, Dr. Sanjay Gupta, CNN Chief Medical Correspondent.